This is just an incredible opportunity for our region here to have one of the four federal vaccination sites here at the dog track in Tampa. You can show up at this vaccination site without an appointment. As was stated, you have to abide by the criteria, and that is the age limit and having a note from your physician if you have any comorbidities. Tomorrow, starting tomorrow morning, Monday, March 22nd, the age limit is being dropped to 50 years of age. So we expect that there's going to be a large crowd here, a large demand when that age range is lowered. So what we ask is, one of the things that you can do, my neighbors are both teachers. They were allowed to be vaccinated. All teachers and school staff are welcome here to be vaccinated as well with an ID. And so what they did is they just checked some of the traffic monitoring apps to see what the traffic looked like around this area, and they picked a time that wasn't as busy as some of the other times during the day. So there are a lot of ways that you can monitor the traffic and get in and out. I had my vaccination, my first vaccination on Friday, since I met the age limit of 60 years old, and it was a seamless process. This site here, funded by the federal government, run by the state of Florida in cooperation with Hillsborough County and the city of Tampa, is an incredibly efficient process. I came in, was registered with my driver's license, received my vaccination, had a 15-minute observation period, probably talked a little more than I should have, so it took 30 minutes, and I was in and out with my vaccination. Have had no effects whatsoever from that first shot. Could barely even feel it when it was administered. So this process is incredibly safe and seamless, and that is a tribute to everyone that is working at this location in cooperation to make sure our community is safe. Now, I cannot stress enough how important it is for everyone eligible to get a vaccination. This is not the only site. You can come here, no appointment necessary. The other state site at Raymond James, you need an appointment there, and you can go to myvaccine.fl.gov and you can register. Even if you don't meet the age requirements right now, sometimes if they aren't busy at one of the locations, they can call someone who has been registered that may not be at the exact age requirement. But you have got to get vaccinated. We are in a race to get people vaccinated against these variants that are coming in. We have hit a plateau with our positivity rate, which is indicative of the possibility of another surge upwards. We've seen some of the footage from the spring break events that are occurring. So everyone that can be vaccinated needs to get vaccinated now. And the reason for that is we can get back to our normal lives, our everyday lives, visiting family and friends, being able to do things that we haven't been able to do for over a year now. So please, 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 I got my vaccination, you get yours. Does anybody have any questions?
There was a pop-up vaccination site that was recently brought to my attention, and I was just, looks like it was Matrix Medical Network. Did you guys hear about that at all? Or do you have any details on that, and if it was shut down or why?
We have a number of pop-up sites that are throughout the county, throughout Hillsborough County. We have had them in a lot of our black and brown communities where transportation may be an issue. And so we're really trying to take as much of this vaccine out to the public as we can. Last Monday, we hosted 350 canvassers at the Police Athletic League, and they are going out and door to door, knocking on people's doors, trying to find out if they are eligible for the vaccine and helping them get registered if they don't have Wi-Fi access. We did have one, I don't know if that was a particular site, where some individuals called out and said, you can come down here and get your vaccine no matter what age you are. And so it caused a little bit of a jam at that location. We can't open it up to everyone, but these age ranges are going to drop rapidly. As stated, it's going to Friday or 50 tomorrow morning, and we anticipate that it'll continue to drop. But there's locations all over at some of the pharmacies, Publix, and a number of other locations out at T. Pepin. The county has a site out there, so they're all over. If you go to Hillsborough County's website, if you go to the City of Tampa's website, tampagov.net, you'll be able to see where these different locations are. We're making it as available as we possibly can.
Mayor, the situation with the Matrix site, that was the one at HCC yesterday, and basically, and I was out there, the majority of people were between 20 and maybe 50, 55 years of age, and so basically the site wasn't asking for identification or anything else. Is that normal, or was that supposed to be that way? What's the situation?
In most cases, they're adhering to the age guidelines, and that, again, will drop to 50 tomorrow. But sometimes somebody tweets out, especially with the younger crowd, and says that this location is wide open, and that causes a race to get to those locations. But we're asking everyone to continue to wear their mask, stay socially distanced, follow the hygiene guidelines, and we're getting to people as quickly as we can. If anyone has any medical condition that would allow them to be able to get the vaccine at a younger age, they just need to see their doctor and they can get that vaccination.
But is that a situation, is that a problem with the city or with the state? Do they have a problem with that company basically?
No, these are all administered by the same group, and that was probably just someone that sent out a message in error letting younger people know that it was wide open, and that's not the case at these locations. We would like to do that, but the problem that you just described is what results when it's opened up. If we told everyone you can show up at this site, it would be mobbed. We don't see that many cars here right now. That's why it's being lowered to 50. And hopefully we'll be able to lower it more quickly as we go through.
Is this site going to be lowered to a second shot only site at any point?
You can talk about that.
So starting Wednesday is when our second doses will begin. As far as that process goes, we're still working to finalize that with the state on how it's exactly going to look like on our campus. Once we have that finalized, we'll make sure that the community is aware when they'll be able to come receive their second doses.
Would that be strictly just second doses and no more first doses, or will you be doing both?
At this time, I don't have an official answer from the state on how that process is going to work.
And also, the reports said there were kind of leftover vaccines, I guess, yesterday. Can you speak to why that is? Is it because there's so many places you can get vaccinated, or is the demand lowering as the age is lowering? Can you speak to that at all?
Can you clarify what you mean as far as leftover vaccine?
There was a report that there were like 1,000 extra vaccines left over yesterday.
We didn't have enough patients come through. We had the vaccine available, and we didn't have the amount of patients that we needed to come through to be able to administer those vaccines.
Does that mean that vaccine has to be discarded, or can you roll it over?
Absolutely not. It is stored appropriately, and then we're able to roll it over to the next day for use.
I can talk about some of the, and I can address some of the discussion about the availability of the vaccine itself. That's something that, again, we really enjoy, that collaborative relationship here in Hillsborough County and really in the entire Tampa Bay region. And I just had a phone call this morning with Congresswoman Jane Castor about getting more vaccine to our particular area so that we can start lowering that age much, much quicker. And if you look at the state positivity rate here in Hillsborough County, although we are continuing to decrease in our positivity, we're still a point to 2 points higher than other regions in the state. So we are fighting to keep this site here, this federal site here, and also fighting to get more vaccine supply to our particular region. I came in on Friday, the Johnson & Johnson, they had already run out of that. I intended to get the Pfizer anyway because I'm always available for a second appointment, but we are fighting for that in this region.
And as far as appointments, do you have to get an appointment to come on down
No, you do not have to have an appointment at the dog track. You just show up. They have the availability of doing 3,000 doses a day. And to my knowledge, haven't hit that mark yet. We've gotten very close. 3,000 here a day, 3,000 at Raymond James, and a series of pop-ups throughout the region.
What advice would you give to someone who may be concerned about traffic coming out here to this site?
Yes, if you're concerned about the traffic, which is really a great question and a great concern for tomorrow when the age range is lowered, because there aren't appointments and specific time sensitive, check all of the apps that monitor traffic in this area, and you'll be able to see when the traffic has died down. I know when the age was lowered to 60 that we had a couple instances where we had to shut down exit lanes on the interstate. And so just pay attention to that. You should be able to come in. I can't tell you how effortless this process it is. It is so well organized on every single aspect. So all we need from the community is to come down and get your vaccination. No matter what the site is, get the vaccination. All right, thank you guys.